Hi IDT friends. I'm sorry I couldn't physically be there with Tim to present to y'all, so I hope you accept my virtual proxy. I know prosthetics is a foreign field to most of you, so before I delve into any specifics about our instructional design problem, we're going to give you just a little bit of background. So as Tim alluded to just a moment ago, we were tasked with helping a prosthetic practice with their new amputees, and they were having problems managing how their prosthesis fit on a day-to-day basis. So what we're going to do now is take just a couple minutes and watch a short video so that you guys can all get a better visual and understanding of what Tim and I are going to be talking about.
Oh, hello, glorious denizens of YouTube. Let's talk about stump socks. These are stump socks. They are made for your stump. Stump socks come in different thicknesses, from very, very thin to super duper thick. Usually they come in bags like this, and they are measured in a couple of different ways. First, they are measured by their dimensions. So this one is a 3-inch by 5-inch by 12-inch. And they're also measured in ply, which is the thickness of the sock. Ply, P-L-Y. I have got a huge collection of stump socks. This is a 1-ply sock. You can see it's very thin. This is a 2-ply sock. You can see it's a little bit thicker. This is a 5-ply sock. You can see that it is very thick. Usually the socks have a colored ring sewn around the outside so that you know what size they are. So for example, this brand, the green band means that it's a 2-ply sock. Now that I'm using the pin lock system for my prosthetic, these socks have a hole made in the bottom of them on purpose so that they can be worn with a pin liner prosthetic. Oh, I see you! Socks are used primarily between your socket and your liner to increase the volume inside. Right now I am wearing a 2-ply sock, 2 more ply of sock, and a 5-ply sock. When you first get your amputation, your limb is very swollen, and over time it shrinks. It takes about 6 months to a year for the shrinkage to level out, and in the meantime you want to be walking around on your leg, and so what do when your limb shrinks and it is too small for your socket? You use socks to increase the volume in your socket. This temporary leg 2 weeks ago fit me, and now it is way too big. Only a couple weeks later, you can see without any socks, my leg just flops around. This actually fit 2 weeks ago. In order to make it fit properly, I add socks. Socks are usually color-coded. For this brand, red means 4-ply. These are socks that I cut in half because I'm shrinking faster in the end of my leg than I am up at the top of my leg. Now I wear my prosthetic. And now it fits in there nice and tight. Pretty tight anyway. It's really important if you're a new amputee to use socks to control the volume inside your prosthetic. The reason being is if you don't have enough socks, then you'll notice that you'll sink down more into your prosthetic and you will bottom out on your prosthetic, which means that more weight of your body will be on the bottom of your leg, and that hurts. If you're a recent amputee like me, you will have to add and remove socks all the time. I probably add more socks about every 5 or 10 minutes of walking if I'm doing straight walking, And this amounts to me taking my leg out of my prosthetic and adding socks probably 3 or 4 or 5, maybe even 5 times a day. Of course, since I have to change my socks all the time and add socks, this means that I have to carry a pile of socks around with me. I probably carry around more socks than I need, to be honest. I started out with no ply of sock, and by 2 weeks later, I'm already wearing like 7 or 8 ply of sock. Eventually, my prosthetist is going to make me a new socket, and that socket will be a lot smaller, and so I won't have to worry about having so many socks. And also, my leg will eventually stabilize, so it won't continue to shrink so rapidly, so I won't have to worry about socks so much then either. As I've said in previous videos, it's important to wash your socks. The package says to wear clean socks every day, but to be honest, I've just been reusing some of my socks because my socks are all between my liner and my socket, and I don't really see the need to wash them every day because they're not really getting dirty. They're not even having any contact with my skin. Okay, YouTube, that's all for now. Bye-bye.
So now that you have an idea what we're talking about, let's get into the nitty-gritty of the problem and our problem statement. As Tim said, the owner of 3P or Pinellas Park Prosthetics noticed repeated high numbers of scheduled and walk-in follow-up patient appointments made that resulted from new amputees needing re-education of how to manage their prosthetic socket fit. Currently, clinicians or practitioners, as we call them, at Pinellas Park Prosthetics educate their patients about residual limb volume changes and adding and removing socks just verbally in the office. There isn't a company policy or training for clinicians regarding effective delivery of patient education. So we know that when a patient doesn't understand how to manage their socket fit, they're often in pain. And they can get skin issues, which can lead to infection, and sometimes can't wear their prosthesis at all because of it. And that's a serious problem that affects somebody's daily quality of life. We also know that changes in healthcare are pushing for increased documented patient education, greater success in patient outcomes, and a reduction in potential medical errors. Tim also mentioned that practitioners and prosthetists don't get paid for office visits or time that they actually spend with a patient. So essentially they get paid just for the prosthesis itself. So time spent in office for educating patients is costly, and it also takes time away from other patients, reducing their success. So all of these things point to a felt need surrounding Pinellas Park Prosthetics patient education practices. Consequences of not solving this patient education problem include poor patient satisfaction with their prosthesis and their health care, increased potential for medical errors and sentinel events, which sentinel events are very serious medical errors, even leading in death. And so a patient that has a skin issue can lead to infection, which they already have compromised health. So a lot of times that can lead to very poor negative outcomes that are a result of poor patient education or poor care. Increased probability of lawsuit based upon those medical errors. Decreased satisfaction of referral sources, such as doctors and physical therapists that refer amputees to 3P or Pinellas Park Prosthetics. Decreased community perception, as most prosthetists and healthcare providers are out there to help the patient and help the community, and so if they're not having successful patient outcomes, that decreases their community perception. And it's also a loss of revenue and time, as they're having to perpetually educate patients about how to manage their prosthetic socket fit. And that takes time away from other patients or other things that they could be doing to help the amputee community. If you have any questions before we move on to the next deliverable, just go ahead and ask Tim.